Hello, I'm Dr. Gary Gossen. I am board certified in internal medicine and gastroenterology. I have practiced gastroenterology for 32 years in the South Texas Medical Center. I am the director of the San Antonio Endoscopy Center and clinical assistant professor at the University of Texas Health Science Center. I currently practice at Gastroenterology Clinic of San Antonio on Data Point. I was born and raised in San Antonio and graduated from Robert E. Lee High School in 1972. I decided early in life that I wanted to be a doctor, and my education was always focused towards a career in medicine. I graduated from the University of Texas in Austin with highest honors and attended medical school in San Antonio. All of my post-medical school education was at the University of Texas Health Science Center in San Antonio. During my fellowship in gastroenterology, I was able to travel and do externships in Australia at the Royal Brisbane Hospital and at New York City at Doctors Hospital with a focus on biliary endoscopy. I am a member of the Bexar County Medical Society, the American Gastroenterology Association, the American Society for Gastrointestinal Endoscopy, and a fellow of the American College of Gastroenterology. My private practice career began in 1984 at the Diagnostic Clinic in San Antonio. I opened one of the first Medicare approved endoscopy labs in the state of Texas. With the explosion of technology over the last 30 years, I was able to diagnose patients quickly with a variety of procedures that visualize the gastrointestinal tract. I have experience and expertise in endoscopy, colonoscopy, small bowel capsule endoscopy, and motility. The doctor-patient relationship is one of these sacred relationships. I mean, you establish something that will be there forever. It's a very private and relationship where you're able to help somebody, and in that ability to help somebody, you establish a trust. And that trust is something that is extremely valuable, and it is something that is to be cherished. And, I think I have always focused on talking to people. And you come to my office, you see the doctor, and you spend the time with the doctor. If you have a procedure and you have biopsies, you have lab work, the doctor calls you. And I think that somewhere down the line in many practices have been lost. And I think it's important to not overschedule a practice. Everybody gets at least 30 minutes when they come to my office. And that's whether it be a follow-up new patient, you're going to get at least 30 minutes with, yes, the doctor. And that's probably unusual. That is something that I think in gastroenterology, and I get to see a lot of people practice, but I think that's truly something that has been lost. And establishing that doctor-patient relationship initially is probably the most important thing. I think all the gastroenterologists do a fantastic job at doing their endoscopies and colonoscopies. It's down to how well you actually communicate with the patient and the family that separates you from the other doctors. I am involved, along with my wife, with primarily public local theater. Very involved with the local theater because of my daughter. I'm very proud of Carly. She's actually been in many, many plays in San Antonio. We spend a lot of our time going to theater and have enjoyed it immensely. We also athletically exercise. So my wife and I, the one thing I think that has truly kept us together is we love to exercise together. She's my exercise partner. And we have a trainer, and Saturday and Sundays we train. And after that, we walk 3 dogs. We have 3 beautiful golden doodles. In this day and time, it's so difficult for the patient to obtain care quickly and efficiently. And what we do at Gastroenterology Clinic of San Antonio is try to make it easier on the patient. If the patient comes in with GI problems, dehydrated, nausea, vomiting, diarrhea, instead of having to go to an outpatient clinic or an emergency room, we have the ability here to hook you into some IV fluids, hydrate you up, at the same time get your blood work done here, stool samples, get all the things you might have to do in an emergency room, but you do it in a very comfortable setting, reclining chairs, get to watch some TV. Much, much better opportunity to get medical care in an efficient, comfortable way. 25 years ago, I was lucky enough to establish the first Medicare-approved facility for GI procedures in the state of Texas. Since that time, we've been able to develop a fantastic GI lab associated with the Gastroenterology Clinic of San Antonio. San Antonio Endoscopy Center is right below our office. We are staffed with 12 registered nurses. We have anesthesia that is given by certified nurse anesthetists. Your procedures involve typically biopsies and pathology, and that's processed in the building, just upstairs. And we're able to get results very quickly from our pathology lab, the pathologist, and to the patient. All of our patients will receive a copy of their report, the pathology, and a statement from the doctor on how to follow up or any other tests that need to be done. Typically, if there's an abnormality, I call the patient. I want the patient to know right away what we need to do next, and that's part of the process of being an effective gastroenterologist. Part of our uniqueness at Gastroenterology Clinic of San Antonio is our ability to do research studies. We actually have a national company and a local arm of the company, which is Gastroenterology Research of San Antonio. It's a fantastic opportunity for certain patients. There are many complicated diseases in gastroenterology, particularly inflammatory bowel disease, where you have Crohn's disease, ulcerative colitis, a lot of expensive treatments, very difficult for some young patients to obtain what they need at a cost they can afford. And that's where we're coming from. With this, you have the opportunity to participate in research studies, have your blood work, your colonoscopy, and be treated and followed by a board-certified gastroenterologist truly interested in your care and getting